Now we'll move on swiftly to our next session happening up on stage, Biomarkers of Longevity. For this session, we have our holding slide on screen, and we're going to call on stage Dr. Saras. Dr. Saras, you're here. She's here with the microphone and so on. Thank you. Welcome. Give her a big round of applause, ladies and gentlemen.
Hi, good afternoon all. I'm Dr. Saraswathi, a practicing general practitioner and a certified lifestyle medicine board certified physician. Okay, today I want to talk about longevity biomarkers in the age of lifestyle medicine. So I would like to start my talk today with a very simple quote. What we measure, we manage. It's a quote by a man called Peter Drucker. So we as doctors, we live by this principle every day. When we want to manage hypertension, we measure a patient's BP and we use HbA1c levels to actually guide us with diabetic care. So, how about aging? Can we measure it? In the past, we always thought aging was an inevitable process, a background process which cannot be modified. But recent studies have shown that you can actually modify aging. You can slow down aging and extend health span, means years lived free of disability and disease. So, it's not how old you are, it's how you are old. Imagine you have two patients that you meet today, same age, about 55. One is going to get diabetes, cardiovascular disease, going to be in and out of hospital and will be taking medication. And the other one might just carry on his life, active, fit, without any medication. So what's the secret? What makes the difference? The secret lies in the biology of aging. So right now, with the current population, by 2050, 1 in every 6 people are going to be above the age of 65. Traditionally, when it came to conventional medicine, we always focused on managing the disease. We've never thought of preventing it. So, as we realize, aging is a modifiable process and it's influenced by genetics and your lifestyle. We are starting to look into markers, blood markers that can actually help us identify identify levels that we can actually, you can look at those markers and you can treat patients with physicians. These are called longevity biomarkers. They are actually biological signals in our body that will actually tell us how fast are we aging and how long are we going to remain healthy. Okay, some of the longevity biomarkers would be your epigenetic clocks, your Howard clock, your Grimm age, your telomere lengths, your inflammatory markers like CRP, IL-6, TNF-alpha, your metabolic indicators like insulin, your HOMA-IR score, your IGF-1, even your lipid profiles, and even your mitochondrial function. Some of these biomarkers are still in research and they are costly, but some of it we are already doing in our daily practices, just that we are not looking at them as a biomarker as such. So today I'm going to focus on the 3 that are highlighted: the telomere length, the inflammatory markers, and your metabolic indicators. Okay, first, telomere length. What are telomeres? Telomeres are these protective caps at the end of your chromosomes that actually protecting your chromosomes, and every time, naturally every time a cell divides, the telomere shortens. So at one point of time, when it's critically shortened, the cell cannot divide naturally and it undergoes apoptosis. So telomeres, they act as protective caps. So they are compared to those plastic tips at the end of your shoelaces. If you lose those tips, what happens? Your shoelace starts to frayed. So it is seen that as we go through our age, if we are exposed to a lot of stress, smoking, poor diet, and inactivity and chronic inflammation, we actually have a rapid telomere loss. So that lady on the side there, she's Elizabeth Blackburn. She actually has received a Nobel Prize for her research and study on telomere length and an enzyme called telomerase. So what is telomerase? A telomerase is an enzyme that adds telomeric DNA to the telomere to maintain its integrity. So I would like to highlight on a particular study. This study actually is the first human evidence that showed intensive lifestyle change can actually slow down our aging. It was done by Dean Ornish and his team in 2008, where they selected 30 men with low-risk prostate cancer and they put them on plant-based diet, moderate exercise, and those men underwent stress management. And believe it or not, after 3 months, there was a 29% increase in the telomerase activity. So after 5 years, they actually followed back the same cohort and they noticed that those men who actually maintained this healthy lifestyle, they had about 10% telomere lengthening, while the control group actually had rapid telomere shortening. So all this proves, gives us an intangible evidence that lifestyle modification is the base to slow down aging. Next would be your inflammatory markers. I think we as doctors, we use this in our daily practices. C-reactive protein is not alien to us. What does persistent high CRP mean to us? Those low-grade elevation in CRP reflects chronic inflammation. It's also known as inflammation. So it increases the risk of cardiovascular diseases, it increases your risk to diabetes, metabolic syndrome, and increases your risk to frailty, sarcopenia, and disability in older adults. Especially the high sensitive CRP, that is the one you're supposed to be looking out for. Next, you have your IL-6, your interleukin 6. So persistently raised levels of IL-6 is known to increase risk to cardiovascular diseases, stroke, type 2 diabetes, and insulin resistance. They also increase the risk of sarcopenia, disability in elderly population, and they also, hasten your cognitive decline and Alzheimer's disease progression. So when you notice when patients have persistently raised IL-6, they are at a higher risk of frailty and higher risk of hospitalization when they are in the elderly cohorts. And then we have the TNF-alpha. So persistently raised TNF-alpha is known to cause endothelial dysfunction. So what happens? Of course, it accelerates atherosclerosis, and it also leads to insulin resistance, increasing your risk for type 2 diabetes, sarcopenia, muscle catabolism, again, cognitive decline and Alzheimer's disease. So what happens if you have a patient that walk into your clinic and all three are raised? That is actually a very high risk that that patient is not going to have a good health span. Okay, so next we're going to talk about insulin. Actually, when we look at insulin, I think last time or even in government practice, mostly we are looking into HbA1c measurements and fasting glucose measurements to diagnose diabetes. Lately in private practices, I noticed doctors have started to measure insulin levels in our body. So insulin is just a hormone that it's not only the hormone that shows the blood sugar control. It's actually a very important biomarker of longevity. What happens when you chronically have raised insulin levels in your body? You're going to develop insulin resistance, which is going to lead to metabolic syndrome and type 2 DM. But what happens? The persistent state of hyperinsulinemia also leads to oxidative stress. It's going to increase inflammation in your body and accelerates cellular damage. It also, by activating the mTOR signaling, it reduces lifespan. So it also contributes to endothelial dysfunction and atherosclerosis. Usually when a patient walks into your clinic healthy, HbA1c normal, fasting glucose is normal, but the patient doesn't look metabolically healthy. We see those kind of patients with a big tummy, but he's still confident, unhealthy. Try taking an insulin blood sample, usually it will be raised. Elevated insulin usually precedes impaired fasting glucose and HbA1c changes. Okay, so another important score that can actually help you, look out for those patients with early insulin resistance would be your HOMA-IR score. So how do you measure it? I've put up the formula up there. So in practice, HOMA-IR actually gives you an early window to metabolic aging before overt diabetes, making it a valuable biomarker for health span counseling. So how do you interpret it? With the formula, once you calculate, if a patient has a HOMA-IR score less than 2, that means they are actually insulin sensitive. If they are between 2 to 2.9, you're looking at early insulin resistance. More than 3, that is significant insulin resistance. So what does it give us an idea? So the level of insulin actually gives an idea about what are we eating, how much are we eating, how are we moving, how is our body actually storing those excess energy, and how fast we are aging. So it predicts type 2 diabetes way earlier, assesses your risk for all your cardiovascular disease, your non-alcoholic fatty liver disease, and cognitive decline. And persistent raised insulin also drives chronic inflammation, oxidative stress, and endothelial dysfunction. So it accelerates biological aging, and of course, all of this reduces your health span. Okay, lipid profile. I think I don't have to talk about lipid profile. Every patient or every Malaysian that comes into your clinic today, if you're going to take their fasting lipid profile, it's raised. And what are they telling you? Doctor, just raised cholesterol. My cholesterol is just a bit high. And for them, it's normal because whenever it's actually a mistake on the doctor's part also. They don't understand that minimally raised cholesterol today is actually having a compounding effect on our aging, and later on will increase their risk for various diseases. So of course we always look at bad cholesterol, good cholesterol. That's what our patients focus on, right? They come and sit at our table. Doctor, is my good cholesterol okay? Is it enough? Is my bad cholesterol okay, or is it raised? Have you ever seen patients? Who are interested in their triglyceride levels? Or are we interested in our triglyceride levels? Do you guys know that TG significantly shows how insulin resistant you are? So every time you consume, of course, Malaysians, our food is full of calories, full of carbs. So every time we consume and our body takes it in, the insulin tries to shove it somewhere, it sends it to the liver takes it, converts it into triglyceride, puts it up with the VLDL, and it will just ask the VLDL to go store it somewhere. So initially, we're going to start storing those TG in our tummy. We're going to get a big tummy. Soon, we're going to see it around our organs. So we're going to see all those fat in your liver, around your intestine. TG is going to be high for those patients. So in your clinical practice, after this, if you see a patient with, high triglyceride level, the first thing that you're going to ask those patients to do is to cut down their calories. So the minute they're going to cut down their calories, their insulin is going to go down low, they're going to start burning all those fat. They're going to lose their tummy. That's going to be a good motivator for the patient to come back to you, The first thing everybody wants to lose is the tummy, right, Dr. Aisha? The hardest thing to lose is the fat around your tummy. And calorie restriction plays a very important role in that. That's why intermittent fasting and all those calorie restriction protocols actually showing that lower insulin levels in our body prolongs healthy prolongs health span. So next, we have your IGF-1. Of course, it's a hormone that is secreted by our liver in response to a growth hormone. Okay, that one, it has a very U-shaped relationship, means very high levels. In younger days, it promotes cellular repair, it promotes cellular growth, but chronically high IGF-1 will actually increase your risk for cancer, especially your breast cancer, your prostate cancer, and colorectal cancer, because it drives cell proliferation. But on the other end, if you have very low IGF levels, it also causes frailty, sarcopenia, osteoporosis, and cognitive decline. Okay, next is one of my favorite, gut microbiome. Okay, so there are trillions of microbes living in our gut. So how do you feed them? It's your fiber, and fiber. So how many of us actually ask those patients who come into our clinic about their bowel habits? If you notice, most of the Malaysians are actually constipated because our diet here lacks fiber. So a healthy microbiome means you have diverse of species, you have those beneficial bacteria in your gut, the ones that produce short-chain fatty acids, the butyrate. Those are the anti-inflammatory ones that actually help you protecting your gut barrier function and gives you a better immune health. Once you lose those healthy bacteria from your gut, there's reduced diversity, you're going to have those pathobiomes, and you're going to have intestinal permeability, means leaky gut, and your whole system is going to be inflamed. So, how do you actually interpret gut microbiome? Right now, a lot of labs are actually offering this gut testing. I mean, gut health is becoming a thing right now. Yes. So, high microbial diversity is actually a longevity predictor. High short-chain fatty acid producers are actually known to be protective. Low diversity and high pro-inflammatory taxa, those will increase your mortality risk. Now, when we keep talking about centenarians, the blue zones, what was noticed in their gut microbiome was very diverse because their food was predominantly plant-based. They took whole food plant-based, and it helped maintaining a good gut health. Okay, so that actually ends my topic. This is my last slide. So, which are practical and which are the not yet practical biomarkers? So, which are the practical cost-friendly biomarkers? Of course, lipids, your LDL level, your HDL level, your non-HDL level, your ApoB, and then your glycemic indices like your fasting glucose, your HbA1c, your fasting insulin levels, your HOMA-IR score, then you have your high-sensitive CRP, and then we also have some anthropometrics measurements and some functional biomarkers that can also help us predict longevity, like a patient's BMI, waist circumference, grip strength, and walking speed. And then you have your hormonal tests. There are some biomarkers that are actually in research and they still have their shortcomings, like your epigenetic clocks and telomere length assays. Telomere length assays, they're actually just taking blood samples for it. But the problem with telomere assays are each tissue in your body will have different telomere length. So by just taking your blood sample, it's just a proxy. And they always say telomere length is very sensitive to stress, illness, so it varies. For now, telomere lengths are usually used for population studies. They are not exactly using it to predict individual health spans as such. And then there are your multi-omics and proteomics, metabolics, and microbiome sequencing. So, what would be my advice and take-home message today? What can you start practicing differently in your clinics? When you look at a patient's lipid profile, your HbA1c level, your fasting insulin level, your high-sensitive CRP, waist circumference, grip strength, these things will actually give you the most cost-effective insights on how is this particular patient aging and how can we manage. And one of the most cost-effective treatment would be your lifestyle-based management. Your nutrition, I mean the 6 pillars that we practice in lifestyle is known to be the foundation of all kind of sustainable ways to actually slow down aging. I know we have a lot of drugs that are being promoted in the market. Yes, there can always be an adjunct, but the number one should be your lifestyle modification, which is going to be very sustainable and is actually free. The patient can just go back home and start practicing something today. So I would like to end my topic by saying, don't add years to your life, but add life to your years. So please start looking at your patients as a whole and start lifestyle advisors in your clinic. Thank you. And this is another slide that I asked Naja to. So I come from the American Society of Lifestyle Medicine. We are a group affiliated with the Lifestyle Medicine Global Alliance. So every year we hold our conference. So this year also we are having it. So the slide was sorry, just a second. Okay, I'll just proceed without the slides. So I come from the Malaysian Society of Lifestyle Medicine. We are affiliated with the Lifestyle Medicine Global Alliance. So every year we hold a conference. So this year we are having our 5th conference. We're talking a lot about mental health. We're having a lot of speakers, esteemed speakers like Dr. Beck Freds, Dr. Wayne Dysinger. They are flying down in person to talk to you. So do join us. And if you want any information, we have a booth right out there, so do visit us. And we are also an exam center for certification in lifestyle medicine, so if any doubt, do visit us and we'll clear your doubts. Thank you. So I'll proceed with the...
Yeah, we have some questions, I think, already there. Your first question, most clinic labs don't seem to measure or explain as it pertains to heart health in a clear manner. Where should we go?
Okay, so ApoB, yes. So usually, in clinical practice, right, you always look at LDL and you always say LDL is directly linked to cardiovascular diseases. Yes, but right now, studies are showing ApoB is actually the protein that is found in the atherogenic particles in our cholesterol particles. So what happens is, when you measure your ApoB, you get the exact number of particles that are actually entering into your vessels, and that can cause a plaque, the blockage, right? So ApoB is more clinically, precise. The level of ApoB is more specific when you want to assess the risk of cardiovascular disease. So a patient with a higher ApoB is going to be at a higher risk of developing cardiovascular diseases.
Our next one right over here, would you prescribe to a patient to increase a patient's gut microbiome?
Okay, it's a very good question. So, back to our lifestyle. Our first important pillar, nutrition. When a patient comes to you and asks, what can I do to increase my gut microbiome? You just go and tell them, go back home and eat vegetables. Increase your fiber intake. Do you know every man you need 35 grams of fiber per day, and women at least 25 grams of fiber? And most of us, we don't take that. So actually in this era of social media, a lot of people are actually talking about high fiber food. You have your chia seed. 1 tablespoon of your chia seeds give you 5 grams of fiber. So if you take 2 tablespoons per day, you're already getting 10 grams. And Malaysia, we are not short of vegetables. You have your green vegetables, you have your broccoli, you have your capsicum. You just walk into your market and you have so many vegetables. It's just that we don't tend to, we don't practice that. So when you look, going back to that, when you look at our plate, the plate that lifestyle medicine doctors prescribe, 50% of our plate will be fiber. Your legumes, your lentils, your vegetables, your fruits, all those are fiber. Even your complex carbs like sweet potato, those offer fiber. And all these help you to get a better gut microbiome.
All right, one more right over here with Dr. Vishnu.
Which one? Okay. How many, is that one?
How many blood test results?
Yeah, how many blood test results shows a range of HSCRP more than you need to rule out other than cardiovascular disease? Is this?
Are you able to understand the question? I am struggling to comprehend. Is it possible to ask who asked that question? Mr. Anonymous. If you can't understand it, you can definitely skip it.
What test is available to analyze gut microbiome? Okay, there are actually a few labs that actually take your stool samples to analyze your gut microbiome.
I saw a question over there about pricing and so on, right? So I guess there's a lot of options for
okay, so when it comes to pricing, that's why I said there are costly tests. I mean, there are DNA labs that actually test your, DNA sequencing, and they actually give you a whole report of how fast are you aging. If you come from if you practice in the area with the super elite, they are able to afford all those tests. Of course, you can contact labs that do those DNA testing and find out from them how to do those testings. But if you want a more cost-effective, it's of course all your daily blood markers like your high sensitive CRP, your insulin levels, your other inflammatory markers. Those can be a good guide to help you with longevity, to assess the patient's health span.
Correct.
Thank you.
Dr. Saraswathi, we are going back to the slides here that you were looking for earlier. And this is what you wanted, I guess. Go ahead.
So I'm going to quickly swift through our slides. So, Malaysian Society of Lifestyle Medicine. So we are affiliated with the Lifestyle Medicine Global Alliance. If you notice, there are a lot of countries affiliated with them. So every year we hold a conference in Berjaya Times Square Hotel. So this is going to be our 5th conference. This year we are focusing on mental health. So we have Dr. Elizabeth Freites, we have Dr. Ravinder Momtani, they are elite speakers with a lot of knowledge. They're going to come down and we're going to actually do forums, and going to be a lot of interesting talks there. Then we have Dr. Wayne Dysinger, our own president, Dr. Shiva, Dr. Amy, and then Dr. Darshan. So most of our speakers are taking their time to fly down to give the talks. So do take this opportunity to attend our conference. We are also a center for the board certification in lifestyle medicine. So the exam is conducted every year after the conference. So for any details, do come to our booth. So this year the exam is taking place on the 30th October. Yeah, thank you.
Thank you. Give a big round of applause for Dr. Farad. Thank you so much, Doctor. Yes, their booth is right outside, so for those of you who are looking for more information, please do visit them as well. Yeah?